Module Overview. This module presents a comprehensive exploration of prevention and intervention strategies targeting youth substance abuse. It integrates evidence-based models, community-centered approaches, and policy frameworks, drawing from public health, psychology, education, and social work disciplines. The goal is to equip learners, whether educators, counselors, youth workers, or public health advocates, with actionable methods to mitigate risk, address early signs of abuse, and develop sustainable recovery paths for affected youth. This module aligns with international standards, including UNODC's International Standards on Drug Use Prevention, World Health Organization, WHO, Framework on Substance Use Interventions, SAMHSA's U.S. Substance Abuse and Mental Health Services Administration, Strategic Prevention Framework, SPF, NERDC's Civic and Health Education Curriculum, UNESCO's Safe Learning Environments, Toolkit, CPD Accreditation, Guidelines for Behavior Intervention Training. In-depth components of prevention and intervention. 1. Understanding prevention tiers, a primary prevention, targets, the general youth population, drug awareness education in schools, life skills training, decision-making, coping mechanisms, promoting drug-free youth clubs and after-school activities, media campaigns on drug harms, parental education programs. B. Secondary prevention, focuses on at-risk youth, early screening and identification of drug use behavior, peer-led mentoring programs, counseling for students exhibiting risky behavior, involvement in constructive skill-based programs, e.g., sports, entrepreneurship, targeted programs for children of drug-using parents. C. Tertiary prevention, targets youth already using substances, access to rehabilitation centers, psychosocial therapy and behavioral therapy, CBT, REBT, relapse prevention and reintegration services, academic re-engagement programs, legal support and criminal record sealing, where possible. Second, school-based prevention strategies, integration of drug education into health curricula, use of peer education programs, teacher training on how to detect and address drug-related issues, establishment of confidential student support services, regular workshops and talk sessions with recovering addicts, third family-centered interventions, family therapy and counseling, strengthening parenting skills and monitoring, establishing family routines and bonding activities, early intervention for family conflict or violence support groups for families of addicted youths. Fourth, community and faith-based interventions, creation of safe recreational spaces and centers, community policing and neighborhood watch groups, engagement with religious institutions for moral guidance, street outreach programs, and youth empowerment initiatives, partnerships between NGOs, CBOs, and fourth, community and faith-based interventions, creation of safe recreational spaces and centers, community policing and neighborhood watch groups, engagement with religious institutions for moral guidance, street outreach programs, and youth empowerment initiatives, partnerships between NGOs, CBOs, and Schools 5. Psychological and therapeutic interventions, individual therapy, CBT, motivational interviewing, group therapy and support groups, e.g., Narcotics Anonymous youth groups, trauma-informed care approaches, coping skills and emotion regulation training, crisis hotlines, and virtual counseling platforms. 6. Government and policy-level interventions, enactment of youth-friendly drug laws, regulation of access to alcohol, tobacco, and pharmaceuticals, public-private partnerships for prevention campaigns, government-sponsored rehab and reintegration programs, research funding for youth mental health and addiction trends. 7. Digital and media strategies, use of social media influencers to promote anti-drug messaging, development of mobile apps for anonymous reporting and education, anti-substance abuse video games and simulations, online counseling portals, YouTube, TikTok, and Instagram. Drug awareness campaigns. 8. Peer and youth-led approaches. Empowering youth as peer educators. Youth involvement in curriculum co-design. Creation of youth advisory boards in schools. Training young people in leadership and public speaking. Funding youth-led community projects. Critical success factors for effective prevention. Early and continuous engagement. Cultural relevance of programs. Community buy-in and participation. Multi-sectoral collaboration. Youth involvement in planning and feedback.